show you how to diagnose peripheral vascular disease in a patient who's come with renal impairment and has a history of ischemic heart disease. The gentleman in question has diabetes for the last 25 years with and without hypertension. He hasn't been taking any medications for hypertension, but the diabetes has been long-standing. Last year, that was in December 2022, he had ischemic heart disease, acute coronary ischemia, for which he went to a local hospital where he had some stents inserted. At the time, his creatinine was normal, about 1 milligrams, but recently his creatinine has gone up to about 1.7, and he feels weak and lethargic. The important thing to note in this particular patient is that the cause of renal impairment is perhaps not the angiography, but the underlying vascular disease, because he's got atherosclerosis widespread. So I'm going to show you what are the signs to look out for in any patient who may appear. And in this way, you can also assess the circulation in the coronary vessels as well as in the peripheral vessels and elsewhere. So instead of going straight away for a Doppler ultrasound, for instance, to look for circulation in the kidneys, you can do a physical examination, and in that way you can make a rough idea as to what the underlying vasculature is. So if you look at the faces of the gentleman, you'll see that the face is a bit pale, and you'll see pallor underneath the eyes. So the skin appears to be pale, and it's different from anemia. He's not anemic, but because the circulation is poor, and that's why his face it appears to be pale. Looking at the hands, we again see that the fingers are thin and they are shiny, and the nails are white as well. And here the palms are pale. So now kholo, band, kholo, band, kholo, bas. So now the capillary refill time is greater than 2 seconds, and this means that the circulation in these vessels is low. And he's also had angiography done through the radial artery, so we can, just to make sure that we do have widespread atherosclerosis and not just affecting one hand from where the angiography was done. फिर बनाया जाए, खोलो, बंद, खोलो, बंद, खोलो. And once again, we have seen that his palm, it did not become pink in less than 2 seconds, so it took longer than that. So this means the Anton sign is positive and he's got poor circulation. And likewise, when we do the physical examination, he's not that pale, and otherwise he's not breathless either. Now I'm checking his JVP, and the JVP is not enlarged, and we do not have a hepatojugular reflux either. Now, the most important thing in this gentleman is the peripheral vessels. As you know, that atherosclerosis affects the peripheral vessels more than the splanchnic vessels. And here I've got the legs, which appear to be thin and they're shiny, and they're devoid of hair. A very important question which you will have to ask the patients, male patients especially, that is whether they had any hair on their shins before. This gentleman had hair on his shins, but but now he hasn't got any hair, and this is one of the features of trophic signs, meaning thereby that the vasculature is poor, and so he's lost all of his hair. And he also complains of claudications when I asked in the history. The peripheral vessels are very faint, and once again that goes to show that he does have peripheral vascular disease. I've checked his blood pressure, and that came back to be 90/50, so that's on the low side. He doesn't take any antihypertensives and just on a beta blocker. So in summary, if you have a gentleman who's got chronic history of diabetes mellitus, and he comes with features of intermittent claudication, has coronary syndrome, but looking at the gentleman, if you think the gentleman is pale and he's devoid of hair on his shins, and otherwise the Anton sign is positive, then it's likely that he's got peripheral vascular disease, in fact. And the same disease, atherosclerotic disease, is affecting his kidneys, and so therefore we'll have to be very careful giving him an antihypertensive. This gentleman isn't hypertensive, but we'll have to be very careful giving an antihypertensive. Just in case we give an ACE inhibitor, for instance, it is going to deteriorate the renal functions. Thank you.